Good morning, and on the show with us this morning, Dr. Jan Katsnelson is with us. He's founder and CEO of USA Clinics Group. Good morning, doctor.
Good morning. Thank you for inviting.
So great to have you here. Really, really great. Tell us a little bit about yourself and what has led up to you to be founder and CEO of USA Clinics Group.
So originally I was a heart surgeon, Harvard-trained heart surgeon, and I really enjoyed miracles, magic of healing. You have a broken heart and you fix the heart. What can be better? And later, I learned that a few things can be even better than that, because you can help just 1, 2, maybe 3 patients a day. And there are other things that you can help patients that suffer for 20, 30 years without taking any risk and changing their lives. So I, 21 years ago, started Friday afternoon vein clinic. Many patients suffer from varicose veins, bulging veins. It's a reality, it's not just veins, it's just congestion, swelling, pain, heaviness, and nobody was taking care of them. And new treatments through needle hole suddenly changed the life. People thought, oh my God, I feel like new. My legs are 20, 30 years younger. I can do this, I can do that. And helping 20, 30, 40 patients a day, I had the revelation, oh my God, we can just do it. I was in Chicago that time, then I was in New York, and I saw everyone around in August and Brooklyn with all these problems. I said, I know the secret, nobody else knows. Why can't we help? So that's how it started. Many patients had not just vein, but arterial problems, meaning there's 2 parts, like fresh water and sewer. So fresh water is arteries, sewer is the veins, for comparison. So when people have blockages, it was more complicated. So we tried to send to the hospitals. Nobody was taken care of. Complicated. Language, insurance, difficult. And we decided to do it ourselves. And then we hired doctors called interventional radiologists. It's a very confusing name. The radiologists, people know, right? X-rays. But interventionalists, what exactly they do? Apparently, it's the best profession in the world. They have a license to do whatever they want anywhere in the body. Isn't that nice? Mm. Because through the needle stick, They can deliver treatment anywhere.
Right.
And they said, we can help patients with fibroids. So Harvard-trained heart surgeon, what fibroids? And I learned that 70-80% of women suffer from fibroid disease that treated terribly. Basically, it's a fibroids. It's like a tumors in the uterus that grow. They're benign, but they grow huge. And they end up with hysterectomy and other things instead of through the needle hole fixing in the office. And I thought, wow. By that time, I already knew happy wife, happy life. And in general, women, they're superhuman. They work, they do everything, and they've been suffering. Nobody helped them. And we started doing this, and we realized that nobody knows. Nobody cares. And we thought, well, we'll just communicate to the women and men too. And that's how we started. USA Fibroid Centers, right away, fibroid fighters.
Yes.
Because you have to fight sometimes for yourself.
Mm-hmm. Doctor, really great background that you shared with us. Spend a little time on what fibroids are and how common they are.
So fibroids are benign tumor. It's like strange, right? Tumor, how can be benign? Is it terrible? Is it bad? Is it dangerous? So benign means it doesn't kill you right away. Kill you, but it can kill babies. Tumor means something grows. So imagine something grows in the uterus. Uterus, it's an organ where baby is supposed to grow and nothing else. But apparently there's like a muscle that grows inside tumor. It can be totally inside the uterus, inside the muscle, or even outside. And can be 1, can be 20 or 30. Can be small, can be as huge as grapefruit. And that creates 2 problems. Creates problem of irritation from inside, and if something irritates from inside, it usually bleeds. So women have prolonged heavy menstrual period. What is prolonged? Not like 50% instead of 3, 4, 5 days. No, twice, 3 times, 4 times. And what is a lot? 10 times a lot. So it can be 1 or 2 weeks menstrual period, constant bleeding, or 3 weeks out of 4. The number of, the hemoglobin that we measure how much blood you have in the body. Blood is actually water and red blood cells, from simplicity. Red blood cells, that's what makes the blood red, and it carries oxygen. So normal is 15, 16, whatever the number, we measure. When it's half 8, we think, maybe we can consider a blood transfusion. There are many women that walk around with 5 or 6 or 7, even 4. And if you don't have oxygen carrying capacity, it's just not enough oxygen energy for the whole body to walk, to breathe, for liver, kidneys to work, for anything. So you have those bleedings, heavy bleeding, but you lose a lot of blood. And you have, because a tumor, it compresses other things. One is terrible thing. Do you remember I told you benign doesn't kill?
Mm-hmm.
It's not. There's a small print everywhere. It kills babies because it competes with babies for space and blood. So baby loses. It's number one reason for miscarriages. Miscarriages, it's a simple word for spontaneous abortions. And many fibroid diagnoses is because women lost a baby. Today, with the fertility problem that many men cannot bet, like when women have a baby, it's a miracle.
Sure. Yeah.
People pay extraordinary money, and after that they lose. In addition to like normal human loss of life. So that's fibroids. And if it compresses on the bladder, women go, I have a small bladder. It's kind of cute. What is cute about this? They run to bathroom all the time. They don't have a small bladder. They have nice bladder. There's just something compressing this. Or they cannot go to bathroom, constipation, because something compresses. So basically, this benign tumors is, you'll be okay. You can live with this. Who cares? I mean, you feel it. I don't feel it. So you can live with it. It will not kill you. I will not. It's not malpractice issue that I don't fix you. And the typical treatments are, hormonal, will just make you bleed less, or pain medications. Until it's a lot, provide comfort, or make you drug addict. Neither good. Or we have great surgeries. These tumors, how about we'll resect them? And you have many in your uterus. Too late for removal. We just remove uterus. It's like castration. If you'll be a man, let's just remove the balls. Why do you need it? You already had a baby. So I don't think many men would agree.
Right.
Women don't really have a choice. Many women do that for reasons, early hysterectomy, because they cannot function. In Vietnam, there were people just do a hysterectomy because the employer cannot make them come to work every day. But if they bleed 2 weeks out of 4, they cannot work. So basically, for women, progress didn't occur. But there are different options.
Right. Doctor, if people want to get more information on everything we're talking about, how can we get that information and where can people go?
USA Fibroid Centers.com is an amazing website. A lot of information.
Dr. Jan Katsnelson is with us, founder and CEO of USA Clinics Group. What are some of the symptoms to know, and why do you believe that raising awareness on fibroids is so important and urgent?
So symptoms are prolonged heavy menstrual period, pain, especially during intercourse, losing babies, spontaneous abortions or miscarriages, constipation, small bladder symptoms, and weakness in ability to perform. It's a physical, social, mental, and even financial impairments that can be completely fixed. So why is it important? So doctors do basically think about any problems from 2 different angles. One is risk and benefit. Like if I do something, what's the risk, what's the benefit? So diagnosis of fibroids cannot be easier. It's ultrasound. What is ultrasound? It's sound beams, and transvaginal or transabdominal. 5, 10, 15 minutes. I don't know, $100, even if it's not covered by insurance. Certain states cover it completely because they passed a law because fibroids so important to them, like in Florida. Hopefully it will be law everywhere. It's in Congress for the last maybe 10 years. Cannot get through. So that's a diagnosis. And will it change the management? That's fancy word for doctor. Should I do it or not? Was it a waste of money and time? Should we open Pandora box and scare everyone? You have this, and what do we do about this? Nothing. So we have things to do about this. All treatments were very bad. Myomectomy, hysterectomy, I'll tell you more about this. But for 30 years, easy treatment was existing called uterine fibroid embolization. Like many amazing things, that was found by accident. So in France, one doctor was asked to help women with a severe bleeding. She had a surgery and she was bleeding from uterus. How do you stop the bleeding? Like a water, right? You stop the faucet. How do you stop? You plug from inside, called embolization. He plugged the artery and it helped. Bleeding stopped. I thought, wow, tumors grow because they have a lot of blood supply. What if we'll decrease blood supply? Maybe tumors will stop growing. So they used this technique in mid-90s and they realized, wow, it helps fibroids. How about the babies? Apparently plenty for babies. Because think about this, normal tissue, they have certain requirements to sustain themselves. And the tissue that wants a lot, very hyperactive. And that's a normal state. If you don't give them a lot, they cannot function, they die. And they shrink. So the bad actors shrink and die, the normal stay, and that's how by clogging, decreasing blood supply to uterus, tumors die and normal function preserved and women have babies. So this treatment takes 20, 30, 40 minutes and can be done in the office, covered by insurance, 20 years or more, covered by insurance, FDA approved and guidelines for all the insurances. So USA Fibroid Centers, why I know we're the best, we published.
Yeah.
So
yeah,
sometimes certain doctors are fantastic, but we have a systematic approach. We have many offices, many doctors, did a very consistent approach with a complete control of how do we make a decision. And we were able to publish almost 1,300 series of patients sequentially without any exclusion, which is like maybe 4 times larger than anything published, and the only one outpatient with extraordinary outcomes, 15, 20 times better than anything else. Because systematic.
Sure, yeah.
The problems usually don't occur, because during the surgery or procedure, it's the decisions, to do the right thing on the right patient, at the right time, for the right reason. So if you control the decision making, you can achieve extraordinary results. Nothing is given to chance. So if you have an easy diagnosis, and if you have phenomenal, easy treatment free, why will you choose not to make your life the best life?
Mm-hmm.
Why would you suffer?
Dr. Jan, if you could give us a way to get in touch with USA Clinics Group one more time.
The best way about fibroids is to go to usafibroidcenters.com. USA, like the best country in the world, fibroid, the problem, centers. usafibroidcenters.com.
You've given us some great clinical insight on fibroids and treatment options. What else should our listeners know about this important health issue?
It is up to them. Nobody will help them. Nobody will help them. First of all, it's a kind of human nature and explanation why people think it's normal. In my opinion, women are superhuman. For many men, right? Woman does exactly like men, plus many, many other things, and not just cooking. All right? So to have all this load in life and work, and at the same time suffer, the very, productive or typical approach, just carry on, just ignore it. And why not, right? Women know they're different. They know if incidence is 70, 80%, that means most likely not just they suffer, oh my God, I have a disease. No, the sister suffered, the mother suffered, aunt suffered, grandma, the friends, everyone. So if everyone suffered, how's that abnormal? Sounds like it's normal. All right, I'll give you a comparison. Have you seen babies or whatever, first graders with perfect teeth? All of them? All of them crooked teeth, right? By the graduation, it's perfect. So sometimes abnormal and normal, it's a perception. Here it's a disease that ruins life. Physically, mentally, socially, financially, ruin life, the best 30 years. Basically wasted life and lead to castration. Typical treatment.
Mm-hmm.
So normalize an abnormal, that's a huge problem. And there's no good explanation why people don't use the progress to their advantage. Like if you want to go somewhere, you don't wait for carriage, right? You
Right.
just like, okay,
Yeah.
Uber, Lyft.
Sure.
Amazing things, convenience. You don't think twice. I believe there's a bigger problem. Why health system is for health system, not for patients. And why patients need to fight for themselves. That's why we created fibroid fighters.
Sure.
Because in general, if you're in the business of something, you would like to have a business, right?
Fibroid Fighters is a great name. Really, it really
So
explains it right there. You
we
know?
want patient need to fight,
Yep.
not to have a problem. So we cure. Everyone is in the business of care. That's profound. It's a one-letter difference, A and U. We're in the business of care, which is terrible business, right? We educate everyone, people come, we fix them one time, and that's it. We don't have a business.
Right.
What are we going to do? Unemployed. But that's what we like. We want everyone to be perfect, everyone to be healthy. It's unusual. We're really not normal. Everyone, how about normal thing with the fibroids? Let's just grow them. We'll give you this medication. Oh, it's too big, or you lose baby. Oh, I'm so sorry. Let's do myomectomy. Let's do the surgery, open you up like C-section, open the uterus, scrape. But in 2-3 years, 50% reduce. Oh, it came again. Let's try again. Oh, it didn't work. Let's do hysterectomy. A lot of compassion. When women go to the doctor for women's problem, what's the name of the doctor? What? Gynecologist.
Mm-hmm.
If
Yes.
they don't know anything else. Like interventional radiologist, not even, like nobody knows. So if you go to someone who does certain things, unlikely you'll get a different advice. There were multiple studies in medicine, not related to this topic, in general, cardiology, urology, there are many things to skin the cat.
Mhm.
Many, many, many. So you can approach the same thing multiple ways. Even multiple guidelines says, it's doctor's judgment, do this or this or this or that. Doctors decide. How's the doctor decide? Oh, the licensed professional. That's why licenses were invented. So if you license, supposedly you know.
Right.
So how do we decide this or that? So the study showed, depends on the specialty, that's the advice you get. Kind of makes sense. So if you have a heart problem,
Mm-hmm.
you go to interventional cardiologist, that will most likely tell you, let's put a bunch of stents, let's not do. You'll go to surgeon and say, have such advanced disease, we like to do surgery. You go to a urologist, he does one. It's like this is the same specialty, conservative treatment and surgical treatment. You go to one, you get steered to one direction or another direction. So I think, how do you make sense of it? And don't ask me about OpenAI. You just need to be educated.
Sure.
And most of the things, like, they're very simple. Very simple. If you have a fibroid, if you bleed a lot, and it's obviously 70-80% of bleeding, most likely fibroids, do ultrasound.
Mm-hmm.
And if you've done ultrasound, you find the fibroids, and there's a treatment in the office covered by insurance, 30 minutes, hour later you go home and you can have a baby, say no to hysterectomy, just go to this. And call Uterine Fibroid Embolization, UFE. Just, Google and you find who does it and just run. So, and I think in general, it's your body, you're in charge, don't blame doctors.
Right.
Like literally, don't blame doctors, don't blame, just, you have access to information.
Mm-hmm. Mm-hmm.
Go, learn, know your body.
Dr. Jan Katsnelson, our guest this morning, founder, CEO of USA Clinics Group. Fibroid Fighters, I love that name. And if people want more information, where can they go before we go this morning?
We have plenty of information on usafibroidcenters.com, and you can schedule even an appointment and get healthy right away.
Excellent. Thanks for being on the show.
Thank you.